The San Luis Promise Zone is a federally designated area, and they are neighborhoods in San Luis City that have been identified as being areas with high poverty rates. And San Luis has the largest Promise Zone in the country. One of the legacies of segregation is that different rates of health disparities are found between neighborhoods in San Luis. Those communities tend to have higher rates of chronic disease and other health outcomes.
Through BRIC and the REACH, CDC-REACH grant and the Integrated Health Network, we're working collaboratively together to increase access to healthy nutrition and food, as well as physical activity and family healthy weight programs. Together, that combination, we're living into our mission around improving access to health and social services, as well as improving well-being overall for the communities that have been historically disadvantaged and disinvested.
The community knows what they need. So what we do basically is just support their efforts in funding their programs, their different efforts that they have ongoing. Many of them are community gardens, urban farms, and we also support food pantries, food banks, senior centers that are implementing cooking, culinary skills programming, and intergenerational programming between older adults and children.
Physical activity is really one of the best ways for us to stay healthy, especially for people of all ages. It's really important to address safe access for people that are walking, and we know that the faster a car goes, the likelihood that the pedestrian will be killed goes up. One of the ways that we can slow them down is by changing the built environment. You add a little bit of uncertainty that makes them slow down. And so it is really important that we control and slow down cars because they are the biggest threat to people walking and outside of cars, and make it a safe and non-threatening environment out there for folks.
One of the really exciting things about REACH is that it's giving us an opportunity to partner with the community to not only provide better access to food and also safer routes, but also to this Family Healthy Weight program. And the Family Healthy Weight program is CDC recognized. It's based on over 40 years of research that shows that we can help families not only make the changes in the short term, but in the long term in eating and activity behaviors and weight outcomes. But also this program is being funded by the state of Missouri, the Medicaid office. So we can provide this Family Healthy Weight program to the community for free. And I know when we've talked with families in the community, they're super excited to have a behavioral health program like this to support their families.
What sets this project apart is the strong partnership between academic institutions and community organizations. And we are really engaged with the work that the organizations are doing. We really try to support them. We use models of shared governance, participatory budgeting, by providing micro-grants to help what they are doing out in the field. Collaboration is essential here, and that is actually one of the pillars of the Here and Next plan from Washington University in San Luis, which is really having efforts to promote research, people, and community engagement, both in San Luis and beyond. We're really working shoulder to shoulder with them to face many of the issues that the community is struggling with.
What we're doing really addresses just the food accessibility and food sovereignty. And so we want community members to have self-sustaining food systems because, as we can see, if you do not have a lot of money, if you are elder or if you're a child or whatever the situation may be, you may lack those resources and not have the ability to have, healthy food items.
We've done workshops together, people having that conversation. And out of those conversations, you build the structure stronger. People here I didn't know they existed. I met them through BRIC, who are doing basically the same thing I'm doing. So coming together, we can work better.
We want to become the healthiest region in St. Louis County with great food offerings from restaurants to grocery stores to farmers, and not just from the lens of a food pantry or food giveaways, but also the type of food activities that spur economic activity.
I think REACH is actually transforming the way some of these organizations work. It's just really bringing people together and helping us think in collective terms, like how do we heal St. Louis as a whole, and how does our work complement each other? We all want to lift each other up.
We did not get here overnight. It's been generations of disinvestment, generations of lack of commitment to people that look like me and others in the community. And what it's going to take is a long-term investment, deep-rooted policy changes, sustainable funding to make things really happen for the betterment of all of us in society, especially those in these neighborhoods that we're supporting through the Brick and Reach grant.
What excites me is our ability to be able to invest in ourselves and one another. And through that investment, we are truly investing into community and the health outcomes that communities deserve to have. There is promise and there is purpose, and that is to be a vehicle and to be an example of what it looks like for true equity between institutions and community members.